Do you happen to have a lump around your neck, over your head, your nose, and you're least concerned about it because there's no pain at all, and also because it has been there since forever? But this might be the first sign of head and neck cancer amongst many other signs which we will be discussing today. Kuzuzampola and welcome to Dungtsho BBS. I'm Sonam Chiki and I'm your host for today.
Kuzuzampola. I thank you very much for inviting me to participate in this weekly Dungtsho BBS program, and I will be delighted to share all the relevant information that we can discuss and probably try to disseminate so that our people can gain something from this discussion.
The speciality of head and neck cancer is new in the country, so what can you say about this?
True. Actually, the specialty as such is not new, but the availability of human resource, trained human resource, is new in this country. When I joined JDWNRH as an ENT surgeon back in 2013, I started working as a general ENT surgeon for 2.5 years, and then I thought of focusing more on head and neck surgery. So that's when I decided to do my fellowship in head and neck surgery, and then I went down to Kolkata, Tata Medical Center, to do a 2 years fellowship in head and neck surgery, and then I came back recently and I joined back 3-4 months back, and now I'm focusing more on, apart from general ENT work, I'm focusing more on head and neck surgery, which mainly involves surgical treatment of head and neck cancers.
What are the various kinds of head and neck cancer?
Head and neck cancer, it's a very heterogeneous group. The kind of cancer depends from where it originates. So we have, its head and neck region is a conjoint of multiple organ system. And to begin with, if we talk about common cancers in Bhutan, I mean head and neck cancers, we have cancers arising from the oral cavity. And then even within the oral cavity, we can further divide into cancers arising from the tongue, from the buccal mucosa, from the floor of mouth, from the palate, etc. And another common head and neck cancer that we see here is cancer arising from inside the throat, which technically we call it as cancer of the larynx, and also cancer of the hypopharynx. Then we also have cancer involving the thyroid gland, cancer involving the nose and the paranasal sinuses, and we also have cancers arising from behind the nose, from a region called the nasopharynx, and it's called nasopharyngeal carcinoma. We also have cancers arising from the oropharynx, which is the space behind the oral cavity. And finally, we have also cancers arising from the salivary glands in the head and neck region, and those are called the salivary gland tumors. So it's really a heterogeneous group of cancers which can originate from the multiple organ system in the head and neck region.
Now, what are the warning signs that we should look out for, and when should we be worried about a possibility of head and neck cancer?
Yes, the diagnosis as well as presentation of a head and neck cancer is quite straightforward, because head and neck region, as you know, it's a very visible part of the body. So ideally we should pick up most of the head and neck cancer in its early stages, excepting few cancers. Like for example, if you talk about common cancers in oral cavity, normally the patient will have some ulcer in the mouth. So the typical thing of a cancerous ulcer in the mouth is that the ulcer doesn't heal on its own. So rather it keeps on progressing in size, and sometimes they can have pain, bleeding, etc. associated with the ulcer. And the typical feature of that ulcer is it does not heal on its own, and it keeps on increasing. And if somebody is having ulcer in the mouth, be it anywhere in the mouth, which keeps on increasing in size and which stays there for more than 3-4 weeks, that should really strike the person that he needs some kind of investigation to find out what kind of ulcer is that. So an ulcer in the oral cavity is one of the commonest way of how a head and neck cancer in the oral cavity can present. Then if we go to the throat, inside the throat, the voice box, what you call as the larynx, is necessary for production of normal voice. So what happens when the larynx gets affected is the tumor or the cancer usually starts with a small ulcer in the throat. So particularly if that ulcer occurs in the vocal cord region, the person can have changes in voice. So a middle-aged person with a change in voice which is not resolving for more than 2-3 weeks should again alert the person that this could be one of the features of cancer, especially throat cancer. And if it is little advanced, the patient can also come with difficulty in swallowing. The first way of presentation is a lump in the neck. So that particular lump in the neck, it can be a single lump, it can be a multiple lump. The most important feature is that lump can keep on increasing in size. If it is because of an infective cause, usually it is associated with pain, and usually it resolves over a few weeks. But if it is a cancerous lump, to begin with they may not have pain, but if it is really associated with an infection, they might have pain. But otherwise, usually it's a painless lump which keeps on increasing in size and which does not resolve. So those are the common warning signs of head and neck cancer. If you look at some specific cancers, for example, cancer of the nose and paranasal sinuses, they do not actually have a particular specific feature of a cancer. So a person with a nose and paranasal sinuses, paranasal sinus tumors can have a normal, common symptoms which we normally even have during cough and cold. Like they can have stuffy nose, they can have bleeding from the nose, they can have change in their olfactory sensation. So those kind of common vague things, which should again, especially if you are, if this does not resolve over time, because if it is just an infective cause, it usually it has to settle down within the next 2-3 weeks. But if it stays for a longer time, then again it is a sign that you should seek some medical advice regarding that kind of symptom. So those are the common ways how a head and neck cancer can present.
So what is the prevalence rate of head and neck cancer in our country?
Head and neck cancer actually belongs to this part of the world, especially India, Bangladesh, Nepal, Bhutan. In Bhutan, we don't have an exact study to find out the national prevalence rate of head and neck cancer, but from whatever data that we have collected so far, head and neck is supposed to be the third commonest cancer in Bhutan, but that is without excluding thyroid cancer. Now, thyroid cancer is very much part and parcel of head and neck cancer. So if we include thyroid cancer among the other head and neck cancer, probably it would be at least number 2 or even number 1 in Bhutan. So it is really rising, maybe because we are picking it up, and also maybe people are now becoming more aware and then seeking medical attention. So that's why we usually see a rise in these cancers, and especially in this part of the world.
Now, how do you diagnose the head and neck cancer, and what are the treatment options available?
Especially for cancer, we need to be very accurate from the very beginning. So any cancer diagnosis has to be diagnosed with a tissue diagnosis, which means if we see a growth somewhere in the body, we have to take a biopsy. And that biopsy will be again subject to further examination by our pathologist colleague in the laboratory, where they break down the specimen into smaller tissues and then they have a look under microscope. And any cancer has to be diagnosed with the tissue diagnosis most of the time, with exceptional few cases. So supposing a patient comes with an ulcer in the mouth, then, and if I clinically suspect that is to be a cancer, then my first way of evaluating this patient is to take a tissue biopsy. So I would just take a biopsy from that ulcer and then send for histopathological analysis. And the report should be available within 1 to 2 weeks, which will actually confirm my clinical suspicion that this is a head and neck cancer. supposing a patient comes with you know, a lump in the neck. So usually for a lump in the neck, the first initial workup is to again take a sample from that lump. So normally we don't open up the lump. So what we normally do is we do a procedure called fine needle aspiration. So in this procedure, what we do is we poke a needle inside the lump and take out some cells from there. And again, this is subjected to microscopic examination, and that will again see the presence of cancer cells within it. So if we see cancer cells within that particular sample, then again that is diagnostic of a cancer. And if it is, and then that is with relation to taking a specimen or taking a tissue to actually look the tissue under microscope and then confirm the diagnosis. The other ways of evaluating a head and neck cancer is then the second step is we normally do an endoscopic examination. So normally we have endoscopes pertaining to the nose, to the throat. So if we suspect any cancer inside the nasal cavity or inside the nasopharynx, then we do a procedure called diagnostic nasal endoscopy. So it is an endoscope which we pass through the nose, and it goes right back to the back side of the nose, and we can actually visualize the entire area with that particular endoscope. So that gives us a fair idea to see whether there is any presence of any ulcer, presence of any changes which can indicate the possibility of a cancer. Then any cancer, after the diagnosis, it has to be subjected to a staging workup. So staging in cancer is very important. The reason being, any kind of treatment modality has to be based on a certain staging. So the treatment modality, the extent of treatment depends on the staging of the disease. So for staging, normally we have a clinical staging as well as pathological staging. So clinical staging again involves imaging of the area. For example, a patient is having suspected cancer in the throat. So then now what we see with the eyes is through the endoscope and visual examination, and then we do a CT scan of the neck. And that is to see the inner extent of the disease, how far the disease has actually spread, which has actually escaped our visual examination, but which is more visible on an imaging like CT scan. In cancer, we have to be concerned about not only about the primary site from where the cancer arises, but we also have to look for other areas where it has actually gone, because that again changes the management. So what we call as a staging workup. So normally for head and neck cancer, we scan the chest to see whether the cancer is limited to the head and neck region or whether it has gone to the chest. So it is a standard protocol in head and neck surgery, head and neck cancer, at least to do a CT scan of the neck and a chest to see the overall picture of the disease, the extent of the disease, and to give us a fair idea about the staging of the disease. Stage 1 stage disease can usually be treated by a single modality treatment, which means we can use either surgery or either radiotherapy. So in head and neck cancer, the role of radiotherapy is also very much there. So in early stages of disease, we go for a single modality treatment, which is either surgery or radiotherapy with chemotherapy. Then as the disease is more advanced, especially stage 3, stage 4 disease, then we have to combine different modalities of treatment. And here if the patient is operable, then we go for surgery. And after surgery, again, the patient, because of the extent of the disease, he might even require further adjuvant treatment in the form of radiation and chemotherapy. So what we normally call as the combined modality of treatment. So that is for higher stages 3 and 4. But there are also diseases, for example, usually in head and neck cancer, the choice of treatment, the initial choice of treatment, if the patient is operable and if the patient is fit to undergo a surgery, it is the treatment option is usually surgery, with few exceptions. For example, if we have a cancer in the nose called behind the nose called the nasopharyngeal cancer, here it's a very inaccessible area by surgery alone. So here the treatment modality is radiation and chemotherapy. So in this case, the first choice of treatment is radiation and chemotherapy. But otherwise, most of the time, the first choice of treatment is surgery. But there is also exception with the cancer of the throat. For example, in case cancer of the larynx and hypopharynx, doing a surgery, major surgery in this area will be, it will affect the patient's voice. It can also affect the patient's swallowing mechanism. So the aim of treatment especially in cancer of throat, is to preserve as much function as possible. So supposing if we detect the disease in early stage 1, stage 2 throat cancer, here again the treatment of choice is radiation and chemotherapy. The reason is because we want to preserve the organ as much as possible, because nobody wants to lose their voice, right?
Yeah.
So by giving radiation and chemotherapy, we do with the hope that the disease will be taken care of, but at the same time, the patient's organ can be preserved. So with that intent, we go for radiation and chemotherapy in throat cancer, especially in early stage disease. But sometimes in stage 3, stage 4 disease, the disease is quite advanced, which cannot be cured by radiation and chemotherapy alone, and that's when surgery comes in. So that's when we might have to even sacrifice voice box, because that's from where the cancer is arising. So we have to take out the entire cancer, and then probably the patient might also need, if the patient is fit enough to undergo further adjuvant treatment, then the patient might also require radiation and chemotherapy apart from the surgery.
Okay, now next are some series of questions pertaining a particular surgery that you did recently. But before that, I would like to say that there are some certain clips which might not be very pleasing to look at, so viewers' discretion is advised. So, okay, the first question is, on what disease did the operation take place in this case?
So this gentleman was having cancer affecting his tongue. So he had at least a stage 3 disease involving the right side of the tongue, which it has started from the lateral border of tongue, and which has gone back even up to the base of his tongue, and from there the disease was extending even to the palate and even coming to the bone. So it was quite an extensive disease, which warrants an extensive surgery. So that's why we thought that if we really want to give a cure for this person affected with tongue cancer, then the treatment of choice is surgery. So we have prepared him for a major surgery. So what we did in this case was, so in cancer surgery, the principle behind any cancer surgery is we have to take out the cancer and also a part of normal tissue along with the cancer, because we as surgeons, we use our eyes and hands, so we remove what we see with the eyes, and we also remove what we feel with the eyes. But as you know, that cancer occurs at a very microscopic level. Even one cell is enough for a cancerous growth to happen. So we ensure that apart from the cancer lesion, we also take a cuff of normal tissue, what we call as a safe margin. So taking a safe margin will ensure that we are removing as much possible cancer as possible. So that's why the surgery is very extensive. So in this particular case, what I did was I have removed half of his tongue, and including part of his soft palate, and also half of the right jawbone, because the cancer was entering into the jawbone. So for sake of completion, I had to do a very massive surgery in this case. It lasted almost 8 hours. And after removing the entire half of the jawbone along with the half of tongue and part of the soft palate, then obviously there is a big defect which remains there. So the main concern in head and neck surgery is it is in a very sensitive area, right? So any major surgery in the head and neck region will obviously have issues with the aesthetic. That's number one. Number two, because it is a multitude of organ which is there in the head and neck region, the patient's function can be affected. So he will have issues with speaking, he will have issues with swallowing. So apart from the aesthetic part, we also have to look into the functional, how the patient will recover functionally. So that is in comparison to surgery in the abdomen, where we don't actually have to look about the aesthetic part of the surgery. But in head and neck surgery, we have to look into that aspect as well. So with the huge defect created after resection of the disease, we need to reconstruct to as normal as possible. So we have to give back the function as normal as possible in terms of speech and in terms of swallowing. So in this case, what I did to reconstruct the defect was I have taken a muscle from his chest. So what we call as the technically it is called the PMMC flap, where we take part of the chest muscle called the pectoralis major along with the skin in his chest to reconstruct the oral cavity. So I have delivered the flap from the chest to the oral cavity and then sutured it back, so that at least once he's fully recovered from surgery, at least he will have a near normal swallowing and as well as speech. And although we are not being able to give back 100% aesthetic in this case, but definitely he will be free of disease, and with the kind of reconstruction that we have, he will not even look that bad after going massive resection of his face.
Doctor, you mentioned that it was a major surgery. So, which stage was it in?
It was at least stage 3 disease, because he had cancer not only in the oral cavity involving the tongue, but he also had cancer which has spread actually to the neck. We have lymph nodes in the neck. So we have around 300 plus lymph nodes in the neck. So any cancer in the head and neck can actually spread to the lymph nodes in the neck. So this particular person has already a lymph node which is having cancer in the neck. So apart from the surgery in the oral cavity, we also have to dissect his neck to remove as much possible lymph nodes as possible, which we suspect there might be cancer inside.
So what was the success rate of this surgery?
Actually, surgically this patient is cured of cancer. So we could remove the entire cancer en bloc. And the patient was discharged recently. He will still have issues with swallowing, because we have removed half of his tongue and we have reconstructed with the flap. So that the entire oral cavity is now new to him. So he will have some adjustment issues. He will have some difficulty in initial phase. It's like riding a bicycle, you ride a bicycle, you fall down, again you practice, again you ride, and one fine day you'll have the balance,
What are some of the complications that can arise from such surgery?
The complication wise, it is like any other surgery. We have what we call as the intraoperative complication and complications after the surgery. So in this case also, like any other surgery, any surgery which involves opening up the entire thing involves the risk of bleeding. So patient can lose a lot of blood during surgery, but unfortunately in this case we haven't lost any blood. We did he didn't lose much blood, and they can be damage to major structures, because the neck region, as you know, is quite complicated. A lot of nerves, a lot of big vessels going into the brain, so you have to be quite careful when we handle those parts. So any complication can arise in that area. And then we have complications relating to the post-operative period. So the commonest complication that can arise is he can develop a wound infection. Fortunately in this case he didn't have any wound infection. His wound healed very well. And then, as I said, he can have initially because of the swallowing issues, since he's not being able to swallow properly, he can have aspiration in the lung, going to lung. So he might as well have something like a pneumonia, what we call as the aspiration pneumonia. So those are the complications that can arise, particularly in this kind of major surgery. But fortunately, in his case, he went through all without any of those complications. So he's quite fortunate.
That's good to know. Well, I was there during the surgery for a while, and it was one meticulous act with a lot of dedication and long hours. Doma chewing does cause mouth ulcers and cancers. Now, apart from doma, what all factors lead to or cause head and neck cancer?
So that's a very important question with regard to our habits as Bhutanese, because head and neck cancer, as I said, belongs to this part of the world, Southeast Asia mainly. And the reason is because we have three common habits which are proven causes of cancer in the head and neck region. The first one is smokeless tobacco in the form of, we have baba, we have kaini, you know, all sorts of smokeless tobacco which people use. So that's a very common cause of head and neck cancer. In Bhutan, as we know, doma is rampant. The use of doma is culturally accepted. People love chewing doma, so which doma chewing now, what in English it's the areca nut chewing. Now they have even extracted carcinogens, cancer-causing agents from doma or the betel nut. So there is a substance called arecolin which they have recently extracted and is proven to be cancer. And recently, I mean, it is now classified, betel nut is now classified as a grade 1 or group 1 human carcinogen. So it's proven cancer. Again, then we have alcohol. So these three common causes, smokeless tobacco in the form of kaini or baba, then doma chewing and alcohol. So all of these combined have in each of them is a carcinogen in itself, but when they combine, when the effects of the three combine, it can even further increase the risk of developing head and neck cancer. So if we don't have tobacco, if we don't have doma, if you don't have alcohol, then I can say almost 80 to 90% of the head and neck cancers can be prevented or it will not occur. So then we have to realize how important those factors are for head and neck cancer. Salted fish, it is known to cause nasopharyngeal carcinoma, and because of that, there is a certain cancer belt, especially in the southern part of China, where people are used to have salted fish regularly. It was found that even people who are exposed to these kind of dietary habits, they continue to have these kind of cancer even after migration. So a study was done in the US for Chinese immigrants who have been exposed to those kind of dietary habits in the early stage of their life and later on developing the cancer. So diet-related risk factors are also there, apart from other habits that we have already discussed.
Okay, so does it mean that dried salted fish is not good for our health?
It comes with a risk because since it is proven in those countries that it can lead to nasopharyngeal cancer, it is not safe actually to
dried fish. Okay. There is a viewer's question and it reads, are those types of cancer curable if detected at an earlier stage? And if yes, what can be done so much in Bhutan?
Yes. So the treatment in head and neck cancer has come a long way. If we look back, say if in the 1950s, the cure rate is quite low, like only 1 out of 3 patients get cured. And there is a gradual progress in the treatment modalities, the techniques of treatment, and now currently we can see that a person diagnosed with a head and neck cancer, even if it is stage 4 cancer, almost 70%, up to 70% of the patients with a head and neck cancer can have cure actually. So that will be by the different treatment modalities that we have already discussed in terms of surgery, in terms of radiation, in terms of chemotherapy. So right now we have at least a cure rate of about 70%, even in advanced stage.
Well, doctor, any important message to our viewers?
I want to stress on the habits that we have already discussed. So avoidance of chewing tobacco, smoking tobacco, avoidance of betel nut or doma, and avoidance of alcohol. If we can do away with these three, then almost 80 to 90% of the head and neck cancers can be prevented. Then I would also want to stress on the importance of the warning symptoms or the warning signs. A person having an ulcer in the mouth which does not go away and which keeps on increasing in size and which is there for 2-3 weeks, we should not ignore that kind of ulcer. And also a person who is having a change in voice which lasts at least for 2-3 weeks and not resolving, should also seek medical attention to see if there is any possibility of cancer. And then again a lump in the neck which was painless to begin with and which keeps on increasing in size, and sometimes there can be multiple lumps developing at the same time. So those things should actually alert us to consider a possibility of having head and neck cancer. And since it is in a very visible part of the body, I think people should be very much encouraged to seek medical attention in case they have these kind of symptoms running through the body.
Thank you so much, Dr. Pope, for your time and effort. It was a great discussion, and I would like to thank you from core for everything that you're doing to help our people, and we are very blessed and proud to have our very own surgeon. So thank you.
Thank you.